And how does stigma impact adherence as well, too? Any role with that?
Certainly. And for a lot of the women I see, they come in and they've been struggling with something for a long time. And now they come in, they're embarrassed by it. They're embarrassed by, maybe some of the faults they've had in life or some of the difficulty they've had. For men, I think it's a different barrier around stigma. I should be able to toughen up on this. Why do I need to take my medicine? I know my wife gets on my case. I know my whatever, but I don't really need this medicine. So stigma about that. I just did a consultation with one of our major employers, Jerry, and they know one of their biggest mental health challenges is guys with ADHD. But breaking through those barriers, saying there's no weakness to taking medicine. There's certainly no weakness to self-care and taking care of yourself. So stigma certainly can be a place. Finally, you get into stigma about not wanting a bottle with a label on it. Maybe I'm a young person, I'm dating. I don't want somebody coming over and seeing a medicine sitting out that's got a label on it, and there it is, a controlled substance, those types of things. So I think there's stigma within families, there's stigma within ourselves, there's stigma within relationships when it comes to any mental health condition, especially ADHD.
How are we now understanding? How does ADHD present itself in women versus men or girls? Since this is a childhood onset condition, right? How does it differ in girls and boys?
I'll give you a couple of the myths of ADHD, Jerry. So when I first went into training, we were taught a lot of things that we now know are myths about ADHD. So number one of the myths was it's boys, not girls. We now know that isn't the case. Boys tend to have a little more hyperactivity, but by the time you're an adult, we see more women coming in for ADHD evaluations and treatment than we do men. And part of that is hormones matter. We know that as estrogen goes up and down within the brain, it changes the way dopamine binds to dopamine receptors, and symptoms will go up and down as well. So throughout the menstrual cycle, postpartum, as you go through menopause, a lot of our female patients with ADHD, all of a sudden, the wheels come off the bus when they hit those perimenopausal years because estrogen levels drop and symptoms get worse. So women tend to get missed earlier on because we used to look for the boys, but not the women. Myth number 2, Jer, is you're going to grow out of it, right? We were all taught that ADHD is something with, hyperactive boys running around the room. By the time you're adults, it goes away. So just kind of anticipate as you go through adolescence, you should stop your medicine. We now have great long-term data that 90% of children will still have ADHD as adults. 90%. So it tends to be lifelong penetration and lifelong planning when we think about consistent care. Myth number 3. This is another one, Jaron. You and I have gone through this.
Yeah.
Treat with as little medicine as possible. Give people holidays on the weekends, give them holidays in the summers, give them holidays over spring break until we realize ADHD isn't just a learning issue. It's an impulse control issue. So when do you want somebody impulsive and distracted? Is that when they're driving their car? Is that when they're on vacation, driving a jet ski or a snowmobile? Is that when they're going out for their first date and they're trying to decide about intimacy and being intimacy with purpose versus intimacy with impulsivity? So we now know that consistent treatment is by far the best outcome for our patients.